Today I'm going to talk about one of the burdens of my heart and probably yours is all of these disorders that kids have and nobody can figure it out. I'm going to show you a digital motion x-ray of one of the youngsters that we saw here at Caring Medical. Kids with seizure disorder, dystonia, dizziness, vertigo, visual problems, blurry vision, double vision, unexplained headaches, unexplained neck pain, little kids who they can't walk quite right, like their coordination is really bad or their muscle tone is not so good. They probably have cervical instability, and the treatment that is needed is prolotherapy. We're going to watch this digital motion x-ray, and if we could stop it at about 15 seconds. Okay, good. Okay, so instability, how you find it is if you bend down and the vertebrae separate. So this is called anterolothesis because it's anterior. So this is C1, this is C2, this is C3. So if we draw a line at the back of the third vertebrae here, there's this big space here. That's the amount of instability at C2, C3. C3, C4 is stable, C4, C5 there's instability, C5, C6, you could see the instability at C6, C7 is quite severe. So this particular young person, and this was in like a preteen, they had instability at multiple areas, and you could say, well, was the person in a crash? Was the person, did they play football? Honestly, a lot of these kids, what it is the addiction to cell phones or tablets. Like kids, as we all know, kids, even male kids, female kids, they're so flexible. And that flexibility comes because the ligaments are very lax and they don't yet have neck musculature developed. And then kids are supposed to be looking up, and because of the way technology is, kids for the first time in history, they're hours and hours and hours on a tablet or cell phones, and what that's doing is it's stretching out all the ligaments. So now let's look at the C1 C2, and we're looking at, is there overhang of C1 on C2? So if you stop it, this is the end of C2 here, the lateral masses is the end of C1. So look at how much overhang, this space right here, the space right here, that's the amount of overhang. So this particular young person has severe C1, C2 instability. So I'm happy to report, even after the first treatment, the patient had about 50% improvement of their symptoms, and the prognosis is excellent for full recovery. And I'm hopeful in the future to get all these kids, or a lot of these kids, symptom-free.